morning. I'm Dr. Matthew Ngetich. I'm a general practitioner with 20 years experience in various capacities, both as a clinician, an administrator, and a manager of schemes themselves. I'm passionate about managed healthcare systems which are going to deliver quality, affordable healthcare services to all Kenyans. This ties in nicely with what we are trying to do at Ponea Healthcare, where we actually are putting the patient at the center of healthcare. Biggest risk factor, you are aging. 2 is the lifestyle diseases that you're actually likely to get because of the adoption of the Western culture. Very many of us are living a sedentary lifestyle. We are not like the people in the village who walk long distances. Today, if you want to send a child in Nairobi to the nearest shop, chances are they are going to ask for an Uber for a ride of 500 meters or 1 kilometer. Very many of us, we used to walk kilometers just to go to school, to go to the local market, to go to our churches and everything else. Now, those of us who are aware of the health risk factors, you joined gyms. You actually walk around in your compound, you've gotten an exercise bike, you put it in your home to actually counteract the fact that the modern lifestyle is leading you to become sedentary. And when you become sedentary, it means that you do not burn the extra calories that you're taking, because there's been a big change. In the days of our grandfathers, in the days of our fathers themselves and our mothers, food security was critical to the survival of the individual. We take it for granted that nowadays you can walk to any supermarket and actually be able to purchase simple vegetables, fruits around the year. Yet, in the 2000s, 10, 15 years ago, fruits were seasonal. There was a season for mangoes, there was a season for grapes, there was a season for whichever fruit that was out there. But nowadays, because we've got an international means of sourcing these particular foods, you'll go to a typical supermarket or even a mama mboga and you'll find these fruits around the year. When was the last time you went to a mama mboga and she did not have watermelon, for example? Yet that used to be something that we'd see sometime in March to April. By May, it is finished. For the rest of the year, you have to make do with other fruits themselves. Now, because of these extra calories that are available and our sedentary lifestyle, it means that we are likely to be overeating and not burning it off. Take, for example, the staple of the middle class here in Nairobi and other cities. You can reproduce this virtually everywhere. Today, lunch hour, very many of us are going to have chips. We are going to have quarter chicken. A quarter chicken, in the days of our forefathers, if you were privileged enough to visit them and they slaughtered an animal for you, would be enough for 2 or 3 people. A quarter chicken. But it is being eaten by one person. And some of us will take a half a chicken. Our roux is enough for a meal, the size of your fist. But many of us are going to take about 3 or 4 of those. Couple that with the fact that we are couch potatoes, literally. Is it any wonder that you end up with a big investment like mine? You put yourself at risk of cancer. On top of this, you take a lot of alcohol. Alcohol in the older days was something that was brewed for special occasions. It was not something on tap, literally. You had to plan. What were these special occasions? So it was a wedding, for example. If it was a coming-of-age ceremony, you had an important visitor. That's when people gathered, and then they sat down, and then they brewed it. But now, you can leave work and go to your local and have a drink. And how many of us took advantage of that during this pandemic of COVID themselves, to actually have your liquor, your alcohol delivered to you as you sat in your couch, as you ate without exercising because you actually feared going to the gym. All of this multiplies your risk. Now, alcohol intake is increasing dramatically, especially amongst women. I challenge all of you, today as you walk around the city, look at the billboards that are outside there, and you're going to see a very interesting theme if you're keen enough. Most of them are advertising alcohol pops, the sweetened forms of alcohol. These are targeting young people with money to spend and an attitude to spend. The hard liquors that you used to have, the poor tasting beers that you used to have, mostly used to be the trend amongst the older male population. But now we are seeing these sweeter alcohols, the alcohol pops, are targeted at younger people, especially females. And females are very interesting because they have got this philosophy that what a man can do, they can do better, including taking alcohol, including smoking. And smoking is one of the biggest risk factors for development of cancer because it contains a lot of toxins, carcinogens. Carcinogens are things that you will inhale, things that you will ingest, things that you'll come into contact with that are potentially going to cause a cancer to develop in your body. Cigarette smoke will increase your risk of all cancers. It is one of the causes of cancer of the lungs. Now, if you look at old magazines or if you look at old movies, 40s, 50s, 60s, virtually every male was smoking. And you could tell one station in life by the type of smoking that they were doing. Amongst the medical profession, you were successful in your 60s, 70s when you were smoking a Kiko. You were a consultant at my age, and you'd be doing a cigar. And the young doctors who could not afford these expensive things would be doing cheap cigarettes, at times filterless. This has changed greatly because when we carried out studies in the 60s, 70s, and early 80s, we were able to correlate cigarette smoke and cancer. And this led to a huge change in our attitude about smoking. Today, it's very rare to find a doctor who smokes, male or female. Same thing also informed in the decision to actually ban smoking in public because we found out that it is not just the smoker who puts themselves at risk of getting cancer of the lung. It was secondhand smoke in public places. Typically, this was going to be at your local. So it could be at a restaurant, it could be at your pub, it could be in any social gathering where people would light up. Even airplanes. There was once upon a time when it was okay to light up in an aircraft. Can you imagine that? We've come a long way. A study came out from Australia which looked at over 100,000 people who are actually in the service industry, in hotels and restaurants, and they found that the risk for those people who are working in those segments of the economy had the same risk of developing cancer as actual people who were smoking themselves. So you did not need to light up yourself. All you needed was to be in the presence of somebody who was smoking. And you can see there have been a huge change. The WHO has actually recommended and banned smoking in public places. And we've adopted here. Nowadays, you'll not be allowed to smoke in a public place. It could be a restaurant, for example, a building itself, or even in public transport. Now, unfortunately, the biggest market for cigarette makers is the same group that we're talking about, which is urbanized young people, particularly females. These companies, if you look at their spreadsheets, if you look at their financial statements at the end of the year, they're even more profitable than they've ever been. Why? Because they've shifted their markets. The new markets are actually in the third world. That is Africa, the Middle East, and the Far East. The single biggest market for tobacco companies today, as we speak, is China. China has more than 300 million smokers. That's a huge number. That's 3 times the population of Nigeria. That's more than East and Central Africa population combined. And over half of those smokers there are female, between the ages of 20 and the ages of 40. Again, what a man can do, a woman can do better. The second biggest market is India, with over 200 million smokers. And here, it's more than 50% who are actually smokers, who are female at the end of the day. Now, these lifestyle choices that we are making are going to have an effect much later in life. Somebody might say, but I've seen somebody who has smoked for 50 years, hajawahi kuwa mgonjwa. Now, just something to remember. there have been 4 men, the ones who were actually featured in their adverts over the years. All 4 died of cancer of the lung. You'll not hear about them in the adverts, but they died much later in life. 60, 70, 80 years. Now, if you've got a life expectancy here in Kenya right now of less than 60 for the typical individual, it means you don't live long enough to have the cancer. But it puts you at risk of other diseases, cardiovascular disease, for example, asthmas, allergies, and other illnesses. God forbid if you catch COVID when you've got all of these illnesses. You have dodged cancer, you intercept COVID. So there are other risks. It's not just looking in isolation for cancer itself. Thank you for joining us for this session. I'm Dr. Matthew Ngetich. We look forward to having you on our next session when we're going to be discussing any other health needs that you might have. If today you wish to discuss more about cancer or the myths that surround it, or you have any particular health needs, do feel free to reach us on ponea.com. Asanteni.